Dr. Alda Sainfort is a board-certified holistic care specialist and founder of Advanced Healing Wellness Centre, located in the Pembroke Pines in Florida. The centre has been serving the neighbouring and international communities for over a decade. And Dr. Alda joins us now. How are you today?
I am wonderful. How are you?
I'm brilliant, thank you. So, can you tell us some of the things that you do within your wellness centre?
Yes, we offer a variety of services based on Eastern traditional medicine, Chinese medicine, Ayurvedic medicine, which is Indian medicine, prophetic medicine. We do spiritual healing. And with the spiritual healing, we do emotional aspect of things. And we also do Tai Chi, Qigong, yoga, and a full range of massages.
So what was it that made you want to set this wellness centre up?
That's very interesting. It's a very good question. And thank you for asking. I used to work for the University of Miami as a research physician. And part of it, I was happy with my job, but there's another part I wasn't so happy because I feel like there was something missing. And what was missing was addressing the emotional aspect of issues of illnesses or spiritual aspect. As my understanding is that diseases, they are manifesting on a physical level, but that's not the root. So the root goes to the spiritual aspect and emotions, everything else that causes the disease to manifest as a disease. And that led me to exploring more. And I went to study Eastern medicine and to find answers to what is really is happening when someone is ill. And I did find my answers indeed.
Yeah.
That led me to offering the holistic approach to health.
So what is the main difference between Eastern and Western medicine? Because people always talk about Western medicine is what we use. And I guess it feels weird that there's two different types depending on what part of the world you're in.
Yeah, true. With Western medicine, by the way, it's fascinating. If you have any trauma, accident, those type of cases, it's wonderful. But when we talk about long-term management of disease, there's a lack of that. It's like going to a doctor and they take 5 minutes, spend 5 minutes with you, and they give you the medicines. Take it for the rest of your life. It's not going to kill you. Maybe yes or not, but you're not going to get better. You just take the medicine for the rest of your life. And this is the question I always had. If you're taking a medicine long term and it doesn't heal, it doesn't treat the problem, when you stop taking it, then everything resurfaces. Then what is the real medicine? And that was my understanding of Western medicine. Then I wanted to also have the understanding approach of Eastern medicine in relationship to illnesses. And that led me to study those different branches and science of medicines. So Eastern medicine itself, it's detecting the imbalance. We don't even call it a disease because it is a disease when it's manifested on the outside, on the physical. But you can have an imbalance manifesting in the spiritual body. Nobody can see it. You will feel sick. You may have headache, you may feel tired, you may have all kind of vague symptoms, but you would go to a regular Western doctors, they would say, no, there's nothing wrong with you. We cannot find anything wrong.
Yeah.
Because diagnostics do not reveal something is wrong. And if diagnostics do not reveal something is wrong, therefore there's nothing wrong.
Yeah.
But what the body is telling us is that something is wrong in the spiritual body. And this is what later on developed to a full-blown illness if it's not balanced.
Yeah. So why do you think it is that we don't seem to incorporate Eastern medicine much in Western healthcare?
Well, in many countries, they incorporate both Eastern and Western medicines, like, for example, in India, China, and many other countries, except for in the West. I think the people are who need to make the change based on what the needs are. Because if they keep accepting what is given to them, they don't explore something different, something that could work, then the change is never going to happen.
And do you incorporate both Western and Eastern medicine into your own work?
No, I'm for full-blown Eastern, yeah. Because I see results in Eastern medicine, and I believe in it. And I do Western medicine too, because that's where I started my career in Western medicine. But I feel a very deep connection with Eastern medicine, because we're not treating the person, we're not treating a disease. The body knows what to do, and the body's doing the work. When you help this person balance the body, it may be with nutrition, with advices, decreasing stress, meditation, and teach them how to go to bed early rather than going to bed very, very late. Like 12 o'clock in the morning, 1 o'clock in the morning.
Yeah.
We have to follow the rhythm of the day, the rhythm of the night, and that helps keep the body balanced.
Yeah, we maybe don't think about it, but sleep does play a huge part in our health, doesn't it? And not just going to bed at a reasonable time, but keeping it consistent and making sure you get enough sleep.
Yes,
if you
absolutely.
have barely any sleep, that's bad for your mental health and physical health.
Yes, absolutely. Because when we go to sleep at a very reasonable time, but I would say 9, 10 o'clock, the body needs quality sleep, not quantity. We could spend all day sleeping and we do not get quality sleep, because during the night between 10 and 2, 3 o'clock in the morning, that's the highest quality sleep we get.
How do you stay updated with all the advancements and news in the Eastern and holistic medicine world?
I've been in school all my life, and I'm still in school. Even with all the degrees I have, I'm still in school because there's so much to learn.
Yeah.
And I think no matter how much time I can spend in school, I would never finish to learn. And even though I'm learning so much, I still don't know anything.
You've had many testimonials. So can you share a few examples of people who have benefited from your healing?
Yeah, absolutely. There's a young lady, I always use her example because she was very skeptical. And she came because she didn't know what else to do. And she was taking all kind of medicines, steroid, and nothing worked. And she said, this is my last chance. And so when I felt her pulse, because I do my kind of sort of diagnosis through the pulse and looking at the tongue. So when I felt her pulse and I felt something internal, and I shared that with her. And then when I went deeper and I felt that her throat chakra is completely blocked. And so because this is blocked, it's causing problem on the cervical spine, the from C3 to C7. And I told her that she needs to express herself, her voice, and give her voice to whatever. Then she understand that, because she said all her life she was never able to speak the truth or to speak whatever she feels or whatever is not right. And so I did a healing for her just to balance her energy. And she was able to release so much of that. And the next day she sent me a message. She said to me that the pain, she used to have pain on her left arm. And after the healing, the next morning after the healing, she woke up and the pain was completely gone. And since then, she was completely healed from that pain, because that pain was coming from the blockage on her throat, referring to also back C7. And that was very, very powerful. And I only worked with her one time, and that was gone.
That's incredible. I guess it's a good thing that you only have to work with somebody one time, because it means it works. But could that be seen as a negative because you don't get repeat business?
No, it's not. We do see them for maintenance and mission. But the good thing is that these are the people who refer their friends, the family, because they see result.
How do you approach a patient who maybe could be skeptical about the effectiveness of holistic or spiritual healing? Because I think a lot of us are used to Western medicine, and that would be our first port of call.
Yeah. Yeah, I don't have to do anything. The body does everything.
Yeah.
Because when I feel the pulse, I'm able to say if you are a very angry person, if you are holding anger, if you are holding resentment, if you worry,
Yeah.
if you are up in your mind, in your head. So when I feel the pulse, I get a lot of information. I can feel the state of the liver, of the kidney, of every organ. And I
Wow.
tell them what I feel in the pulse. And when I look at the tongue, it gives me a lot of information. And I tell them that. And it's like a mind blowing because they never thought from the pulse you could get so much information.
Yeah.
Because in Western medicine, when we feel the pulse, we are, measuring heart rate and respiratory rate. Western medicine, it's all about you, the individual, your internal organ. We can feel everything going on in the pulse.
Yeah, and that sounds quite easy for you, or you make it sound easy, probably because you've got so much experience and know what you're doing. But do you have any challenges sometimes, or have you had any challenges along the way?
Yeah, the challenges I may have is someone who's really, really skeptical and doesn't think that would work. And so they would come with a barrier, like a block, like blocking me from reading them, from feeling. But I always have used my own approach to help them relax and feel calm. And once they get to that point, then it becomes very easy.
Well, what's coming up for you? Do you have plans to expand your wellness centre or projects that you're working on?
Yeah, I do have a lot of plans to expand. And most importantly, what I've been doing lately is working with family lineage healing. And I'm very happy that I will be traveling throughout Europe. I have a
Nice.
retreat coming up in Spain,
Ooh,
one in Greece.
nice.
And I am very grateful to really touch those territories to help bring healing to those countries and many other countries in the world. So people know there are options because we see patterns, we see so much things happening. And there are lineage. We call that genetically inherited, or we call that familial. But these are all family lineage healing patterns that need to be healed.
Yeah. Well, where are we able to find your wellness centre and keep up to date with you everywhere?
Yes, my website is www at Advanced Healing Wellness Center. No, sorry, I have two websites. Let me check. What's my website? Yeah, it's info at AHW Center. Is that correct?
Yes, I've got ahwcenter.com. That's the website, right?
Right, that's the website. I don't even know my own website.
Yeah,
I'm
well,
so used to having it pop up automatically.
Yes, and that's centre spelt the American way, ending ER, just in case you put it the British way and end up somewhere completely different. But many thanks for talking to us today. It's been great having you on.
Thank you very much, Toby. Thank you. And I look forward to be in touch with you again.